Also, health officials say the flu is under control, but severe cases are still popping up every day. But even when it's not flu season, we all run the risk of catching some kind of cold, virus, or sickness.
But what if we knew where all the germs were before we even left the house? Our health reporter Rose Belts found a few apps trending on social media that may be able to help.
It's our natural tendency to Google our symptoms, self-diagnose, then try and weed out the best remedy when we're not feeling so hot. But now there are apps designed to help you avoid catching those germs by pointing out sick zones. The Sick Weather app scans social media networks like Facebook and Twitter, then records millions of different reports of sicknesses each month, breaks cases down into individual diseases, then gives an area a sick rating and score based on that data. The app is relying on social media posts, and let's face it, who feels like posting on social media when they're under the weather? Clearly it's not perfect, but the app does offer a way for families to track household illnesses, which could help the data, and resources to find a doctor. The Doctor's Report Illness Tracker app was released this February and encourages people to work with their doctor to prevent and defend against getting sick. It does this by tracking the same data healthcare providers share with insurance companies and government agencies across the country, including the CDC. The technology is available as an app and website and is capable of tracking 15 conditions, contagious diseases, and other spreading health risks, including flu, pneumonia, bronchitis, and strep throat. It uses graphs, charts, and maps to show where diseases are most prevalent, and also gives quick information about symptoms and prevention. The information claims to be accurate because the data is diagnosed by healthcare providers in near real time. The Washington State Department of Health says these apps are not a replacement for vaccination, good hand washing, and hygiene, and medical care. I could not find a physician to speak about the apps, but according to a few digital articles, doctors do think free apps like these are a good way to inform people about the health risks that are present in their community. Rose Belts for Crime 2 News.